Hi, and thanks for watching AirSculpt TV. It's Thursday at 4 o'clock, and we're so happy that you've joined us. I have a really exciting announcement to make, which is we developed a new procedure at Elite Body Sculpture using AirSculpt technology. It's called the HipFlip, and we're going to be talking about that today. What is a HipFlip? Well, if anyone who's watching, a lot of you have probably heard of a hip dip. A lot of people have hip dips. They don't want them. They didn't know there's a treatment. So we developed a treatment for the hip dip. It's called the HipFlip because we're flipping your dip. I'm going to explain all of this in detail and answer questions. After I've done that, we're going to go live to Seattle and we're going to watch a fat transfer to a hand and show you how we can rejuvenate hands dramatically and instantly using AirSculpt. But first, let's talk about the HipFlip. So I had so many patients complain about their hip dip and they said, isn't there anything? And so we developed this and our patients are extremely happy. So wanted to wait until we had some nice before and afters to show everyone. So we're going to show you some before and afters, explain how it works. So Lauren, will you show the next slide, please?
Absolutely.
Okay, so here we go. What we're going to do is show a little animation of what is a hip dip and how we do the hip flip. So, and just play that again. So, go back. Okay, so this is a hip dip. What you see here is you have your love handle here and you have your saddleback or outer thigh here. And you have this depression here. And what we're going to do is turn that frown upside down. How are we going to do that? Just like that, which gives you a really nice hourglass contour and silhouette. The way we do that is by taking unwanted fat from anywhere in your body and putting it in your hip dip. As you can see here, let's show it again. So there you can see this depression here, and on this side, that's the after picture. You can see that she doesn't have it. So, and now we'll show you a couple more. So let's show a few more of those before and afters. Yeah, go ahead over here. And here's a perfect example. Here's the dip, and we've taken unwanted fat, in this case from her back, and filled that dent so that she has a nice, smooth hourglass contour that all of our patients seem to want. Do we have some more before and afters to show?
We just have this one right now.
Okay. So I think that's really important. And we're going to be doing one live eventually. But I wanted to show everyone that this exists and we can help you. And we have a slider right now on Instagram with a few before and after pictures. So you can see a few more. We posted it yesterday and everyone was very excited about it. So I wanted to make sure we had an opportunity to tell people what it was. But we can use unwanted fat from nearly anywhere in the body, transfer it into the dip, which you can see right there, and then create that nice smooth silhouette. Usually if we're going to do it, we'll also do your waist to give you a more of a snatched look. So what we're going to do next is talk about fat transfer to hand and go to Seattle, and then we'll do questions and answers. So let's see how they're doing over in Seattle.
Great, just give us 1 second. Technical difficulties, guys.
Okay.
All right. There we go.
All right.
Just waiting. All right, we're connecting.
Hi, everyone.
Hello. So we're live in Seattle, guys. I like your mask. We got to get
Thank
some
you.
Elite Body Sculpture masks.
Sorry.
So, you want to show us around?
I think I lost you. Yeah, of course. So this is our beautiful Seattle, Washington location. This is our lobby here. Let me flip this so you can see it. There's staff there. And if you guys are wanting a consultation, feel free to call in. Our phone number is 206-602-3699. If you're familiar with the location, if you're familiar with Seattle, we're specifically located in Bellevue. So here we have our consult room. Yeah.
I like
and
the
so
tree.
Yeah, these are so nice. So we'll come in here and chat for a little bit before you get to meet with the doctor, go over your body goals.
Well, I want to meet Karen. You could go in the operating room. Let's take a look at Karen.
Let's take a look. Hi, guys. How's it going in here?
Hi, Dr. Bullis.
Hey, is that Dr. Rollins there? How you doing?
It is.
So we have done lipo both arms, and I put about 10 or so cc's of fat into this hand, which compared to the other here, let's
talk to Karen for a minute. Hey, Karen.
Yeah.
How does it feel?
It's amazing, absolutely amazing. I'm so grateful for this, not only for you and the company, but this procedure is just absolutely amazing.
Thank you so much. We're grateful that you would share your experience with us and all of our viewers. We really appreciate that. Did the AirSculpt of your arms hurt?
No, it's surprisingly no. I mean, it was just so smooth. It felt like kind of like the experience of an electric toothbrush, but inside your arm, and kind of like a massaging at the same time. So it was very, very good.
Were you nervous?
No, not at all.
Good. And what does it feel like to have the fat injected from your arms into your hand?
To my hands, there's really nothing to feel. I could hardly feel it. I'm really surprised at how easy and so smooth, and everybody's just been absolutely wonderful, and I would recommend it to anybody.
Thank you so much. What we want to do is show people how once one hand is treated and the other isn't, and show everybody the dramatic difference. But before we do that, what made you decide you wanted to do your hands?
Well, I'm getting up there in age. I'm aging, and the energy level is the same, but my body isn't keeping up with the pace of my energy level, you know, the youthfulness of me. And so I was getting self-conscious because, you know, your hands are so exposed. I mean, you can, you know, put makeup on your face and, you know, do things on your face and other parts of your body that will be kind of like cover up, but unless you have gloves on your hands, they're so exposed. And so I was getting really self-conscious about, you know, looking older and so forth. But yeah.
Well, I think it's a wonderful thing to do. I've done a lot of hands in my life, and my patients are so happy. And what's dramatic is when you look at one hand done and the other not done. I mean, your hands are going to look like they're basically 18.
Yes.
And, right. Everyone sees your hands every day, and there's nothing that we can do. You know what I mean? There's no Spanx for hands. So,
right.
Dr. Bullis, do you have one hand done that we can show the difference?
Well, this hand is maybe 80% done. I've got a couple.
Let me flip it.
Yeah, you can see that. So I've mostly done the mid portion. I need to do a little bit here next to the pinky and a little bit more along the thumb and this side of the here.
And would you show the insertion point? Because I think people have been asking, well, where do you go in?
Here's where we go in, right here. And this is a blunt cannula that you use to go in there. Do you want me to demonstrate that?
Sure, yeah, go ahead.
Go ahead.
We're going to watch Karen have the fat injected in her hand.
So we're going to go right over here, get this side first.
Yeah, and I literally cannot even feel it.
And it looks, you know, at first when I put it in, it'll look a little bit lumpy, but what I'll do is massage it around and it'll spread out real nice and evenly. Yeah.
Perfect. Well,
that's a little bit there.
Let's look at one hand versus the other so people can see.
All right.
It's that one.
Together.
So I see you have some tendons showing and some veins and stuff like that.
Wow.
So you can see, isn't that neat, Karen?
It's fabulous.
Put some there.
Absolutely fabulous.
It's going to look a million times better than that. I mean, he's in the process of doing it. So, but you can already see a dramatic change. Like, we're going to show some before and afters, guys, of some hands. But a lot of people don't know this is possible. So it's really a big help to show our patients that there is a treatment for hands. And you see your right hand has the tendons and veins showing, and everything looks smooth and beautiful on the other hand. So
It takes away the crepiness too a little bit.
yeah.
Nice.
Oh yeah, it does. It improves the skin quality as well. It's very good.
Yeah.
Yeah.
So it doesn't affect your ability to use your hands at all.
No, and everyone is I mean, especially women are so self-conscious of their hands. That's why they get their nails done and stuff like that, but they don't have any idea that you can take it to another level.
Yeah.
I think we should call it a hand lift because it's like a facelift for your hair.
That's true. Yeah.
There you go.
Yeah. Okay, you're our first hand lift patient.
Oh, thank you.
Nice.
Yeah.
It's a thing now.
Karen, you've been wonderful, and thank you so much, Dr. Bullis. Karen, we'd love to show your results in a couple weeks to everybody, okay?
Yeah, absolutely. My pleasure.
Thank you.
Yeah.
Thank
Thanks
you,
everyone
thank
for tuning
you.
in too. Yeah.
Thank you.
Bye, guys.
Bellevue, this is our Seattle, this is Bellevue, Washington. It's in Seattle, and this is Dr. Bullis performing this procedure, and we hope everyone in the Seattle area or the Pacific Northwest will, who wants to get AirSculpt will let us know. Thank you so much. Now we're going to start answering questions, but thank you, Karen, and thank you, Dr. Bullis.
Yeah. You're welcome.
Thanks, guys.
Thank you, sir.
Okay, so let's look at a hand before and after. Here we have the before, and you can see the little arrows here where you can see veins and tendons. And here, it's 3 months later, and it's all healed and smooth and beautiful. So it is really like a facelift for your hands. And I wish more people knew it was possible because I see so many patients who complain about it. They say, oh, geez, I'm so happy you can fix my tummy or my chin. I just wish you could fix my hands. And I say, oh, we most definitely can. So I just want to increase awareness that this is possible. And we need such little fat to do it. 10 cc's of fat is basically less than a shot glass of fat. And that's all you need. And it's considered permanent. It's semi-permanent, which means it's permanent until proven otherwise. But it really lasts. It works really well. The fat takes very well. Almost all that we put in stays. We purposely put in a little bit too much because we know some of it will leave. But it's an excellent procedure and very simple, as you can see. So let's go over some questions we had about hands from our followers. So the entry points, as we can see, everyone has some creases on their wrist over here. So we go in wherever you have a crease here so you actually have no scar. Or something very minimal that would be hard to perceive. And do we use any fillers? No, we use your own fat that we remove using AirSculpt technology. So you're awake, there's no needle, no scalpel, no stitches the whole time. And you can have a good time, just like Karen is, and move back to your life the following day. Can I wear rings after my procedure? Great question. No, you have to wait a couple of weeks for that. How will the injected fat change my hand's appearance? Well, it's going to make your skin look really, really nice, really smooth, youthful. It's going to take away crepiness or kind of thin, raggedy type skin. It's going to help cover up veininess and tendons that show more and more with age. It's going to basically give your hands a facelift. It's going to restore youthfulness, the plumpness that comes with age. As we get older, our hands kind of thin out. So it restores that. And as you can see, there's actually a very immediate result. Can fat be added to the fingers? Actually, yes. So we can add fat to the fingers. That's a very frequent question. And in the picture behind me, we did. Will the fat transfer to my hands hide my veiny look? It sure will. So that's one of the main reasons people do it is as they get older, they notice that their hands have become veinier and veinier, like Ron's over there. So that it's really common. People with low body fat have this as well. I have an infant and I need to carry her. Can I? The answer is yes. So there's very minimal activity restrictions. You can carry things afterwards. You just have to wear some gauze wraps on your hands for a couple of days, but it's actually very quick healing. It's probably, it is the least invasive fat transfer that we do. And just like the HipFlip, all we're doing is taking unwanted fat using AirSculpt and seamlessly transferring it to the area where you do want it. For example, inside your hip dip or in your hands, in this case. Oh, can I drive the next day after getting my hands done? In fact, you can. You can drive the next day, absolutely. Not the day of, because we give you medications. But otherwise, you would be able to. Those are it for that. Now we have some additional HipFlip questions that have come up. So, Lauren, let's switch back to HipFlip behind me. Here's some things: can this help with if I wasn't able to remove my hip dip using diet and exercise? A lot of people say this is a very diet and exercise resistant area, and in fact it is. In fact, some people, their skin is basically where I'm pointing right here. Their skin is tapped down to where their leg bone connects to their hip. And that's kind of what causes the hip dip. Sometimes it has to do with genetic fat dispositions, where you gain fat in the love handle and the saddlebag, but there's this no man's land. So we're able to put fat in there and transfer it in a healthy way using AirSculpt while you're awake, with no needle, no scalpel, and no stitches, and give you this beautiful silhouette that we have over here over my right shoulder. So I think that's a really, really important thing. As you can see, what a tremendous difference that makes. And I don't know anyone who even knew there was a treatment for it, and that's why it's so important that we wanted to show this to you. So, yeah, this is a typically genetic thing that has to do with where the fat grows on your body. It is very diet and exercise resistant because you actually do need fat there. You have fat everywhere, but not there. So it's kind of the perfect place for a fat transfer. Let's see. Does this permanently heal the hip dip? And the answer is, it is considered semi-permanent. It should last at least 5 years. I did people 8 years ago, and it still lasts. So we consider it semi-permanent only because there hasn't been a study of someone who's had it 25 years ago. But as far as I'm concerned, once the fat takes and it's healed, and it should stay exactly the same forever. Will this procedure give me an hourglass shape? And the answer is yes. That is our goal, is to take care of that double bubble and give you a smooth hourglass shape like our logo. Let's see. If you want even bigger hips, can I get this procedure more than once? That question is really more for someone who wants a Brazilian butt lift. So sometimes when we do a Brazilian butt lift, we will fill in the hip dip. So if you want a bigger butt, then the answer is we do a Brazilian butt lift. And we, of course, if you have a hip dip, we always fill it in. Let's see. What other areas should I treat in addition to the hip dip if I'm looking to achieve an hourglass shape? I strongly recommend you do your waist with this. Any amount of waist fat, when you combine it with a hip flip, is going to give you a really dramatic hourglass shape that, as you can see here, looks smooth and beautiful. It's such a gorgeous contour. It's one of my favorite things right now. Let's see. That's pretty much it. Any other questions, Lauren?
Yes. So some people want to know the recovery, what recovery is like as opposed to BBLs.
So the recovery for a hip flip is much faster than a BBL. With a BBL, you're not allowed to sleep on your back, and you have to use a BBL pillow when you sit down for 3 weeks. There's no major restrictions with this. It heals very fast. You don't have to wear anything special or sit down in a special way. You can't sleep on your side, but you can sleep on your back, and it heals much faster. It's a much smaller area than when we do a Brazilian butt lift, so it's very minimally invasive. It's pretty fast to do, in fact.
Someone's asking if males can also get this done.
We have a question if men can get it done, and yes, we've done many men, and there's no problem whether you're a male or a female.
How much fat can be done to do the hip flip?
We can transfer as much as you need to fill your hip dip. So there's no specific amount. It just depends on each patient on what's required.
Would one person be able to take their arm fat and transfer it to the hip flip?
Yes. So you can remove your arm fat. We would take your left arm fat from using AirSculpt and seamlessly transfer it to your left hip dip, and then on the other side your right arm fat and put it into your hip dip and create that contour. Now again, if you're going to do a hip flip, I strongly recommend having your waist done because it's going to give you that snatched look. Any others?
Yeah, we have one more. Someone's asking if normal garments are okay for the hip flip.
Normal garments are okay. Our typical AirSculpt garment will work for the hip flip. We don't need a special garment.
And then last but not least, someone actually wants a BBL and a hip flip. Is this possible?
Yes, we can do a BBL with a hip flip. And when we do a BBL, if you have a hip dip, we include it automatically. So it's not two separate procedures. You don't have to worry about that at all.
Awesome. I think that's about it.
Well, thanks for watching, everyone. Next week, we're going to show some more results, and we're going to show eventually the fat transfer to hand from Karen today, the hand lift, and we'll be advertising what our next 4 o'clock Thursday AirSculpt TV subject matter will be. In the meantime, if you have any questions, if you want to consult either virtually or in person, we're open in every city, and we'd love to hear from you. Thank you so much.